dog came down in the clinic, and it was just, it can't get up, and it's got terrible eye movement called nystagmus. It's only a 7-year-old dog. It's very dehydrated. I'll show you its gums, and we're going to take blood if we can right off its neck, and we're going to run some lab work right away so we can figure out what's wrong with this little one. Because this dog, she's critical.
Thick skin, Doc.
She's really dehydrated. Really dark. It's an in-house comprehensive.
Okay. You can take some extra. Got it?
Yep.
You can see how injected the gums are. See how red they are around the bottom of the lip? And her eye, it dances a little bit when she gets up. Now, can she stand up at all?
No.
It's gonna be hard.
So she can't really, she's so weak. She might be another abscess one for potassium.
Looks like she's a stroke.
Well, she's only 7.
She had vestibular?
It doesn't, she's more, I never see him so dehydrated with just vestibular.
She keeps curling her toes in too.
Yeah, I think she's got something else like that, septic. So she vomited a few days, and then she came in, and this is the extent of what she can do. Her temperature's down to 93. She does have nystagmus in her eyes, but not as much for a stroke victim. But she's just down and out, and you saw her blood was almost black. It was so dark, and she's so dehydrated. We got to get fluids into her just as fast as we can. So Kim's going to try to put in a catheter, and we're going to give her fluids at a pretty high rate, and some antibiotic and some steroids to help her feel better. Well, we're taping a catheter in. I actually put the catheter in, but I'm letting Kim tape it up because she's better at taping. I didn't film that, but it was really hard to get in. There was not much vein there, and we tried different legs. We tried, well, I can't show you that leg now, but we actually tried different legs. To get it in, we tried the other front one, this front one, and a back one. And we each tried, and finally I was the lucky one to finally get it in. I had to do it by feel, not by seeing it, because this poor little one's so dehydrated and so sick that sometimes the veins just don't stand out on the foot. And I'll look down here, you see the blood sugar is very, very low, 29, 26 I mean, and so we gave her some Karo syrup. The BUN is up, 66. The kidneys aren't functioning well because liver enzymes are up a little bit, and the lipase, which is a sign of pancreatitis, is way up. So there's pancreatitis and maybe an infection. This was down, so we gave her a little bit of Karo syrup in a little syringe, and she licked it up. And after we gave her the Karo syrup, she's up looking around now a little bit at least, so that's good. And her nystagmus in her eyes quit, so we got her on the heating pads because you got to warm her up. Her temperature's real low. And then we're going to put her on some IV fluids with sugar in it, and then hopefully that'll get her pancreatitis under control. So you can see after a dog gets sugar in their blood, start to look around, and even she's starting to shiver now. See back there, she's starting to shiver. That's because the sugar is entering all the cells of her body, and even now her muscles are working, and her nerves are working, and her shivering muscles are working, and she's looking better. Why she has low blood sugar and a really inflamed pancreas? Well, she could have ate something that really made her sick. Fatty foods, spoiled foods, allergens, and we hope that the fluids and antibiotics will take care of it. Well, you can see this little one was quite sick when it came in. Its blood was almost black. It just wasn't breathing very well. It didn't have much oxygen in its blood. It was dehydrated, and the kidney enzyme was up because there wasn't enough fluid in its body to make the kidneys run like they should. And the blood glucose was really low, which is not a real common thing for older dogs. Usually it's in small toy breeds. If a small toy breed puppy like a Chihuahua or a Maltese or Lhasa Apso or Shih Tzu are real kind of groggy and fall over or real wobbly, then you can give them Karo syrup. You can always do that to any dog because it's kind of collapsed. You don't want to drown them with it, but you want to just give them a little bit on their tongues and their gum. Anyway, I just thought you'd like to see that. We weren't sure what was really wrong until we got the blood results. So I just want you all to know that that's why we run blood work. It's not just because we want to charge you for it. We just need it to diagnose. A physical can only go so far. Anyway, well, I hope you enjoyed the video, and if you want to experiment with cooking for your dog and cat, Feed Your Pet to Avoid the Vet has slow cooking recipes that my dogs and cats like. Cats are harder, and I've just started to experiment with them a little bit, and so I have some experimental recipes that they really seem to like. But I also alternate it with wet food, canned food with my cats, and I do feed my cats raw meat too. They like raw chicken, they like raw shrimp, they like chicken livers, and they like sardines and canned herring. But anyway, have a great holiday season.